Good morning. Welcome to the very last January 2023 in-service today. It will be led by Erilyn, and she's going to talk about coffee. So it is all you, Erilyn. Except you're muted, and you don't have anything pulled up yet. I was too hasty.
Okay, can everybody see?
I can see it just fine. So I think you're good. And we hear you.
Okay, perfect. All right, so my name is Erilyn, and today we're going to talk about coffee, something I'm really excited about, and I was really excited about this topic because I'm definitely one of the people I would consider myself a coffee snob. Drink coffee every morning, never fails. So if you didn't know, around 90% of all adults around the world consume caffeine in the form of coffee or tea or even energy drinks on a daily basis. Below that, I have a little chart of just the different caffeine contents in a standard cup of coffee and the equivalents for different types of coffee. So throughout this presentation, I'll kind of be referring to a cup of coffee as a standard 8-ounce cup of drip coffee, which has around 130 milligrams of caffeine. However, if you drink other kinds of coffee, you can see the differences there. And then as far as tea, it varies very widely between different types of tea. And that wasn't really the focus, but I just wanted to add that in there, that tea also can have up to 75 milligrams of caffeine. So how much caffeine is considered safe? In adults, it's been found that up to 400 milligrams per day seems to be safe, and that's based on a lot of different studies as just pretty much like a consensus. So pretty much if you have around 3 cups of coffee a day-ish, that's probably fine overall. However, if you are a child, which nobody on here is a child, but if you have children, they can consume up to 2.5 milligrams per kilo of body weight per day. As far as cream and sugar, I know that we live in the South and a lot of people like cream and or sugar in their coffee, but it's not always the best thing if you're trying to get the health benefits out of coffee. So cream in particular, it contains a lot of those trans fatty acids that Ashley was talking about. So really like the bad fats. So those can really kind of cancel out some of the really good effects of coffee. It also just depends how much you typically use. Sugar, it does make it sweeter, it does make it taste good, but it can have a similar effect on those good health benefits of coffee. This is especially problematic if you have diabetes and you dump a bunch of sugar in the coffee. It's not going to have the same effects. And we'll get back to that a little bit later, but I'm trying to give just a brief overview before we get too deep into it. So as far as medications, a lot of older adults in particular, and many young adults as well, can be taking a plethora of medications. And you may be wondering, what is coffee going to do to that? Is it going to interact or make things less effective and things like that? I was able to find some small studies that said there technically is a potential, but it's a pretty weak interaction between coffee and medication in general. I have listed there some of the most common interacting medications with coffee, but the effects were very minimal still. Some common ones that you may see are Wellbutrin or tizanidine, and even some antibiotics. So just keeping that in mind. So moving a little bit deeper into that, if you're consuming anywhere from 1 to 2 cups of coffee per day, which is really considered moderate coffee consumption, it's not going to lead to any serious drug interactions. However, if you are consuming more than that, there is a larger potential. So it's more of, if you're consuming more and more coffee, there's a higher and higher potential for it to interact with your medications. So what effects are there? We are going to talk about really all the different diseases and things that coffee can impact based on a lot of different studies. There are no clinical guidelines that are set up for providers such as your physician or your pharmacist or whoever takes care of you. There's no guideline that says this is how much they should drink every day. So the information I'm about to present, it is kind of a compilation of a bunch of different studies, and many of them look at caffeine as a whole and not necessarily at coffee by itself, if that makes sense. So I will note which ones are specifically just for coffee and which could also talk about tea as well. So first and foremost, talking about the cognitive effects of caffeine. First and foremost, the alertness, we know that it's going to make us more alert, more active, because it's going to activate your adrenaline and kind of get you going, if that makes sense. So all of us already know that. It increases our mental energy, ability to concentrate as a stimulant. However, for a headache, the data I was able to find said that it could actually make headaches better or worse, and it just really depends on the person. So we do have medication that you can get over the counter and or by prescription that is for treating migraine headaches and tension headaches that contain caffeine, as well as either an aspirin or acetaminophen or Tylenol, and a few other things as well. So in that setting, it can actually help. However, if you are somebody that drinks coffee or caffeine every day, it can actually be associated with chronic migraines. So if you notice that the amount of coffee that you're drinking every day goes up and up and up, and you start to get a headache, it might be time to kind of taper down on your coffee consumption to decrease your risk for chronic migraines, because nobody wants that. As far as Parkinson's disease, coffee may actually protect against Parkinson's. There was a large meta-analysis, and that just means it's a big summary of a lot of different studies, and they put the data together to find the most probable effects. So a meta-analysis is just that. And they found that there was what is called a dose-response relationship between coffee or tea and lowering your risk for Parkinson's disease. So a dose-response relationship means that generally, if you increase your coffee intake, your risk for Parkinson's actually goes down. However, there is a limit to that because everything is effective in moderation, I found. So specifically for postmenopausal women who may be on hormone therapy, if they were consuming over six or more cups of coffee per day, the standard 8-ounce cups, their risk for Parkinson's disease actually increases by 4 times. So it seems that really staying around that maybe 3 to 4 cups of coffee max is probably the safest and most effective in lowering your risk for Parkinson's. For Alzheimer's disease, the data I found was pretty minimal. It might have a small protective effect, but the studies were not very strong. They only had a very small amount of people that were actually enrolled in the study. And then they had animal studies, but it's not very widely applicable to a lot of different people. So it's kind of hard to say one way or the other, but based on those small studies, it may have a small protective effect. As far as more of the psychiatric disorders, coffee may cause anxiety, insomnia, irritability, and or panic attacks. And this is largely associated with drinking more and more cups of coffee a day, as well as if you have some kind of pre-existing psychological disorder, depression, anxiety, bipolar disorder, or something similar. So just keeping that in mind, if you do have one of those disorders, that if you increase your coffee intake to over 5 cups a day, it could actually make something worse. And so now we're going to move on to cardiovascular effects. So I have this little chart on the right here that talks about your risk for cardiovascular disease. And this is from a large study over, I think it was 100,000 people or something like that. It was a very large amount of people that they looked at their consumption of coffee, and over a 10-year period, how many people actually developed cardiovascular disease. And this could be they had a heart attack, or they had a stroke, or they had heart failure. So any kind of disease of the heart, if they had anything like that over that long period, they were presented on this chart essentially. So based on this chart, if you are consuming anywhere between 3 and 5, or even 2 and 5 cups of coffee a day, of standard 8-ounce cups of drip coffee, or the equivalent in caffeine, your risk for cardiovascular disease actually goes down. So we're going to kind of break that down between the different types of cardiovascular disease, and kind of go into that a little bit deeper. So if you're somebody that either has had a heart attack before or has not had a heart attack before, myocardial infarction is something that can affect a lot of people as they get older. And the studies I was able to find pretty much summarize that if you drink less than or equal to 3 cups a day, it actually may protect against having a heart attack. But if you're drinking much more than that, it could actually increase your risk for other diseases. As we move into blood pressure, the data for that was pretty minimal, in that caffeine in general is not going to majorly affect your blood pressure. So if you are somebody that drinks coffee every day, you drink 2 cups in the morning and 1 cup in the afternoon, every single day, it really is not going to affect your blood pressure in any way, shape, or form. However, if you're somebody that drinks coffee only occasionally, the blood pressure, your systolic blood pressure, which is the first number, the higher number usually, that somebody will read to you when they take it, it can increase by up to 10 millimeters of mercury. And that really is not a clinical concern by any means. So it is very minimal. And honestly, there's so many factors that can affect that. It's not going to increase your blood pressure. As far as data for cholesterol, I was not able to find any studies that found cholesterol affected one way or the other, either your good cholesterol or your bad cholesterol, in regards to caffeine intake by itself. There are a lot of other factors that are studied that may impact results. So there hasn't been a study just on caffeine and lipid lowering medication or anything like that. As far as stroke prevention, coffee is actually associated with a lower risk of stroke, and coffee in particular, not just caffeine. This is supported by many of those studies that were conducted over a very long period of time, where people reported how many cups of coffee per day they were drinking, and it had a very large amount of people. Overall, they found that anywhere between 2 to 4 cups of coffee per day, it had the best data for lowering the risk of stroke. So going further into more of arrhythmias, or like funky heartbeats, this also includes atrial fibrillation, or other funky heart rates that your doctor will mention to you. It's been found that if you drink up to 5 cups a day, it does not actually cause you to have any kind of arrhythmia of any sort, and that's according to several large studies and also case reports. One study in particular, the cardiovascular health study, it found that older adults over 65, they reported their dietary intake of caffeine, and then they kept that consistent, and then they placed them on what's called an electrocardiogram, and that kind of measures how fast your heart is going, the rhythm, and just it takes a picture of your heart and how it functions over a 24-hour period. And pretty much there was no increased risk of arrhythmias over varying levels of caffeine ingestion. So even if one person is drinking a cup of coffee and the other one is drinking 5, there was no big difference between the two as far as it causing weird heart rates in older adults. This is also confirmed by 2 large meta-analyses. Remember, those are where you take a lot of studies and put them together and look at the data as a whole, as well as a large cohort study, which is just a fancy word for a very large group of people that they looked at. They found that between 1 and 3 cups of coffee did not increase a risk for being hospitalized for an arrhythmia. However, those who drank 4 or more cups of coffee actually had a lower risk of hospitalization. So there's a little bit of differing data, but overall it seems to be positive data for coffee and arrhythmias that it does not cause those. It may actually lower your risk of hospitalization. Moving into more of the endocrine system, talking mostly about diabetes and your blood sugar. Insulin resistance is a big problem in type 2 diabetes. And there are really a lot of mixed data that exists for insulin resistance and caffeine. So it's hard to say one way or the other. There are a lot of theories out there that try and justify one way or the other theoretically how caffeine should make your insulin resistance better or worse. But the studies that have been done based off those theories have not really been conclusive one way or the other. So it's hard to say. However, when looking just at type 2 diabetes, if you drink coffee over a long period of time, it may actually decrease your risk of developing type 2 diabetes. There was one retrospective study, a very large study, that found individuals who drank between 4 and 6 cups per day were actually at the lowest risk of developing diabetes over their lifetime. It is recommended, it is not recommended to increase your coffee intake as a diabetes prevention method. So if your doctor says you have prediabetes, it's time to work on these lifestyle factors and a few different, like your diet and a few other different things. It's important to listen to your doctor on those important ways of preventing diabetes and not just start drinking more coffee. But the other studies I found also mentioned that both caffeinated and decaffeinated coffee have favorable effects. It's not known what part of coffee, because it contains a lot of different chemicals when you actually make it, but it's not known what actually causes those favorable effects in type 2 diabetes. Moving into gastrointestinal system. So as far as constipation, coffee is a stimulant, so it may actually decrease constipation. And that's something that commonly patients will say. I've heard a lot of that. But as a stimulant, it activates the smooth muscle in your bowel. So it's able to keep things moving as they should, typically. However, you shouldn't be using coffee as your only method of decreasing constipation, as opposed to staying hydrated and taking your laxative if your doctor recommends it. It's more of just kind of something that can also help in addition to other drugs. For cirrhosis, it is a disease of the liver. Your coffee may actually decrease the risk for developing cirrhosis over time and slow progression of hepatitis C. So it can also be beneficial for the liver in general. Moving into cancer, it really was hard because there's so many studies that are done on cancer. It's hard to say one way or the other for a lot of different kinds of cancer how coffee actually affects it. However, there are also many factors, because cancer is not completely understood in its entirety. There are many other factors that we're not aware of at this time that may have affected the studies I found. However, the most probable data I found was for gastrointestinal cancer and prostate cancer. So it was found that coffee may decrease the risk of both mouth and liver cancer, based on a few small studies. But again, there's many other factors that could have played a role. And then for prostate cancer, both coffee and tea may have a dose-dependent reduction in risk, which again, that means if you are drinking 3 cups of coffee a day as opposed to 1, it may actually decrease your risk more and more so of prostate cancer. And I attribute this mostly to the fact that coffee does have a diuretic effect, which we will talk about soon. But first, going into the musculoskeletal system, osteoporosis, first and foremost. Many of us will develop some kind of bone density lowering over our lifetime, whether that's the form of osteoporosis or not. Coffee may actually decrease bone density and increase the risk of fractures. This is especially a problem for females that are over 70 years old and drink more than 5 cups of coffee per day, which those are the individuals that females that are older are typically the ones that have more of those risk of fracture and bone density issues due to menopause and different hormone imbalances. So they're at the highest risk anyway, but it seemed that those individuals that drink more than 5 cups of coffee per day, they were at a higher risk. Interestingly enough, it seems that tea consumption actually increases bone density due to what are called flavonoids. I'm not exactly sure how those work, and I'm not sure other people really know either, but it's been found that those compounds do increase bone density. For rheumatoid arthritis, there's no clear relationship. There's almost no data out there. So I didn't want to say one way or the other for rheumatoid arthritis. For gout, it can be very painful, very uncomfortable, but it seems that coffee consumption is actually inversely related with again, talking about the dose response relationship. There was a large study that found that pretty much when you're increasing your coffee consumption, it actually decreases your incidence of gout. But this effect really was not seen with tea. So this is with coffee in particular. For urinary frequency and incontinence, urinary symptoms will increase as far as how much or how often you have to go and how fast you have to get there. So as a stimulant, it's really going to increase that diuretic effect. However, if you've been a coffee drinker for a long time, you drink 5 cups a day, and then you all of a sudden cut it cold turkey, it can actually have the opposite effect. So it's important that if you have been drinking coffee for a long time, or tea, if you drink tea, that you gradually decrease it over time so that you don't kind of like flip the table on it and then you're not able to go as much as you need to, because that can cause equally the amount of problems. And then for benign prostatic hyperplasia, or BPH, it's been found that 2 or more cups of coffee per day can actually increase the progression of lower urinary tract symptoms and BPH. So it's not necessarily good if you drink 2 or more cups a day and you have BPH. It can actually make it potentially worse. So just keeping that in mind as well. So I know that was a lot, but now we're going to move into talking about dependence, abuse, and withdrawal. So there are side effects of excessive caffeine that we didn't talked about that are pretty universal, whether it's coffee, tea, or energy drinks, what have you. And these side effects here are based off of a small study. The individuals in this study were quite young, but they actually reached out to a poison control center after they started feeling horrible because they had consumed a ton of caffeine. So the more of the non-serious things that they experienced were tremor, agitation, and stomach upset. As we kind of talked about before, agitation especially is not uncommon, especially if you have some additional psychological disorder. However, more of the serious complications could be hallucinations, seizures, arrhythmias, and ischemia. I know I said that coffee doesn't cause arrhythmias, but this study really looked at younger individuals who were consuming large amounts of caffeine in the form of energy drinks primarily. And if you ever looked at the label on an energy drink, there are a lot of other things besides caffeine in there. So coffee may not cause arrhythmias, but that's not to say in a very high dose of coffee, if you drink a ton of coffee, that it may not cause it. As far as dependence and abuse, there is something called a caffeine use disorder, and it's diagnosed with the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5 criteria. And this criteria is really what doctors use to evaluate a variety of addictive behaviors and other psychological disorders. So on the next page, in order to technically have dependence on caffeine, you have to meet 3 or more of these criteria. So I'm not going to read through all of them because I think everybody has a handout, but some of these, like even I have as somebody who just drinks 1 to 2 cups a day. So just kind of keeping that in mind that it can be addictive, but also helpful to your health. And then lastly, moving into withdrawal. So caffeine withdrawal syndrome, it's technically not a thing yet. It hasn't been defined by any trials or evidence thus far, so you can't have caffeine withdrawal syndrome. However, caffeine withdrawal is real, and you may have headache, fatigue, decreased energy, decreased alertness, drowsiness, irritability, brain fog, and even feelings of depression after cutting caffeine cold turkey. It's important to note that these symptoms can occur in 12 to 24 hours if you drink even 1 cup of coffee per day for 3 days. So it's very important to kind of keep that in mind. If you start feeling a little funky, that's probably why. And if you've been drinking coffee for a long period of time, to kind of gradually go down on your consumption is going to have the best effect. And you're not going to have to deal with as many of these side effects. So overall, coffee seems to be something that is overall good for your health, but also in moderation. There are no clinical guidelines that guide your physician or your pharmacist to tell you one way or the other on a lot of things, but the data I was able to find is generally good for coffee in moderation. Based on the different charts and things that I presented, I think that between maybe 2 and 4 cups a day is probably the sweet spot if you're trying to get the most health benefit out of coffee. But it really depends on you and what kind of diseases that you may have, how coffee can best benefit you and what amount, if that makes sense. So these are my references, and I'm happy to take any questions.
Who might have questions for her? I'm still going to drink my coffee. Don't care.
Me too.
Although that was an excellent in-service. All right. I don't see anyone unmute. Never mind. Go ahead, Judy.
Okay, quick question, because I am not a coffee drinker. I do drink tea, and I also drink my Coke Zero. The caffeine and soft drinks, is that equivalent to coffee, or is it a smaller dose? I'm just curious.
It's an excellent question.
Yeah, so I think it really depends on the soft drink. I didn't really go into soft drinks in particular because a lot of times, depending if you drink normal Coke or Coke Zero or Coke Diet Coke or Coke Zero Sugar, there are so many different things that are also included in those soft drinks. So I don't want to say that the caffeine in that soft drink is going to have necessarily the same effects, because there are other ingredients in there. I don't actually know how much caffeine is in soft drinks on the top of my head, but it should say on the label. I'm pretty sure they have to say on the label of the soft drink how much caffeine is in there.
They don't actually, unless it's an energy drink or one of those specifically noted. I am not sure I've ever seen caffeine content listed on Coke or Mountain Dew or any of those, actually.
Interesting. Yeah, I'm happy to look it up. If you just give me a second.
Yeah, that's an excellent question, Judy. I don't have an answer.
And I'm looking at a label and I don't see caffeine on where it's listing the percents or anything.
They don't have
And
to.
so it's just on the ingredients. Yeah.
Mm-hmm.
And so obviously it's not that much. I mean, there's just, I think a lot of younger people who don't drink coffee and they get their caffeine from other sources. So I was just curious. Thank you.
Yeah, so it looks like on average, if you drink some kind of cola of some sort, it's anywhere between 30 to 50 milligrams per 12 ounces is on average. So interesting though that they don't have to report that. I didn't expect that.
Well, do they list that on coffee? You know, if you buy ground coffee, does it?
Well, for coffee, it's a bit different because it really depends on how much you, I guess, extract from the coffee beans. So like I have an espresso maker, so I can kind of like decide how much espresso I want to pull from, say, 18 grams of coffee. I can decide if I want to pull 1 ounce, 2 ounce from that same amount. So the amount of caffeine is really going to differ based on how much you take out of the beans, if that makes sense. So these like values I have listed at the top are really on average, but not at all inclusive. So generally dark roast beans are going to have more caffeine as compared to a medium roast, as compared to a light roast, if that makes sense.
Yeah, it makes sense.
The other thing is, Judy, is coffee doesn't have to say it because that bag of beans is going to depend upon how big your scoop is.
And also it's coffee that's in there, not, they're not adding anything. It's just the coffee bean. And so, and I thought of that as soon as I asked that question. It's like, okay, that's like a dingy question to ask.
It's also going to depend upon how the different types of extraction of coffee are going to give you plus or minus the various amounts of caffeine.
I think just also to add to that, like if you look on this chart for espresso, you can use dark roast beans for espresso, but you can also use them for drip coffee. And the temperature and the pressure at which you extract the coffee is going to get you different amounts of caffeine. So if you did a dark roast in your to get espresso, it's going to give you 40 milligrams per 1 ounce. Whereas if you did a dark roast and a drip coffee, because there's less pressure and less heat, you're only going to get 130 out of 8 ounces. So it's significantly less, even if you would use the same beans.
That was an excellent question. Are there any other questions for her?